A bill that would for the first time put state regulations on clinics prescribing the addiction treatment drug Suboxone is heading to the Tennessee House this week. It's News Channel 11 at 5:30. I'm Josh Smith.
And I'm Sarah Diamond. Friday, Senator Ken Yeager told us he introduced this bill after so-called Suboxone clinics started popping up without regulation, causing some concern from the community. But today, News Channel 11's Allie Hines talked with a Suboxone prescriber who says the state needs more facilities prescribing that drug.
Guys, at least 50 doctors right here in Johnson City are allowed to prescribe buprenorphine, also known as Suboxone. According to the U.S. Department of Health and Human Services website, I talked with Dr. Tom Reach, a Suboxone prescriber, who says more regulations are a good thing, just not at the cost of access to care. He says there aren't enough prescribers in the state.
I've heard it said that more prescriptions are written for buprenorphine in East Tennessee than anywhere else in the state. Thank God.
A statistic some call a problem, Dr. Tom Reach with Watauga Recovery Center calls a positive.
There is this perception that buprenorphine medications are a problem, that people are using them to get high, when that's just not the case.
Places like Watauga Recovery Center treat addiction with not only Suboxone, but counseling and recovery programs.
For a patient who's severely addicted to strong narcotics, you can put them on this medication and they can get their lives back.
Reach says his facility is already meeting standards the state would require under this bill.
But it may help other offices improve their practice.
But Reach says the first version of this bill would have shut some facilities down and put more patients back out on the streets. It required facilities prescribing Suboxone to get a certificate of need, or CON, from the state.
Anything that restricts access to care costs people their lives.
We do not have enough buprenorphine providers in the state of Tennessee, and that may shock a lot of people, and that may make a lot of people upset. But a lot of people are ignorant to the fact that that physicians can only treat 100 patients. And when we're talking about 15% of society struggling from this disease, we have to ensure the most access to care.
Paul Trivet helped craft a new version of the bill in the House. Instead of requiring a CON, the state will come up with regulations for these facilities.
It is a good regulation in the sense to give the licensure to ensure best practices, the best access and care.
Allie Hines, News Channel 11, in your corner.
The bill is set to come to a vote in the House this week.